My name is Michael Ann Bradley. I work for United Way's Everyday Strong program. So we're looking at anxiety and depression among kids, and we're seeing more and more kids who are showing symptoms of it, more and more kids who are being diagnosed with it. So we teach parents and other caring adults how they can build safety, connection, and confidence in the kids that they care for, right? Whether it's their own child, teacher, neighbor's kids. And when you teach safety, connection, confidence, when you help kids feel those things, then you're getting closer to being able to help them overcome anxiety and depression. In Everyday Strong, to me, it's transformative, right? Because it totally flips the script of how we think about kids. I think it's actually really interesting to think about how often we sort of go at kids with this assumption about their motivation, right? We see a kid who maybe we kind of know that they're anxious or depressed, but we think, well, if they would just try harder to cope with this, or if we could just teach them more ways to cope with this, right? They might just do better, right? We always sort of assign bad motivation to them. I go out in the community and I do these presentations to families, to teachers, to parents, and afterwards there's just a line of people coming up, and so many of them say, thank you so much for giving us this training, for giving us this information, for giving us this new way of looking at the problem. And they feel like, that was me, that was my child, right? Some of them even wonder, right? Wait, did you have a secret camera in my household, right? Because they see how this is something that they're dealing with, and yet nobody's talking about it, right? Nobody's telling them that it's okay to talk about it. Here's a useful way to think about it. Some people even told me that they're crying in the presentation because it resonated so much with the problems that they're facing and the things that they're trying to solve for their family and their child.